Welcome to Clinical Chemistry High-Yield Questions for Medical Technology Board Exam Part 1. Which protein is quantified by standard protein electrophoresis? 1. Fibrinogen, 2. Transferrin, 3. C3. So A, 1, 2, and 3, B, 2 and 3, C, 1 and 2, D, 1 and 3. So sino dito ang kasali sa standard protein electrophoresis? The correct answer is 2 and 3, transferrin and C3. In standard protein electrophoresis or SPE, serum sample is used. Plasma sample is not recommended because of the presence of fibrinogen, which can cause false beta-gamma bridging. The beta-gamma bridging is associated with liver cirrhosis. So paki-remember, wala na pong fibrinogen ang serum because na-consume na siya during clotting. So that's why serum is used because wala siyang fibrinogen, which can cause false beta-gamma bridging. Next, essential electrolytes in acid-base balance. Calcium, bicarbonate, potassium, and chloride. A, 1 and 3, B, 2 and 4, C, 1, D, 3. The correct answer is letter C, 1. So, except all our components, essential components in acid-base balance, the bicarbonate, potassium, and chloride. Calcium is not a component. Next, serves as a first responder to stress by acting within seconds. A. Cortisol, B. Catecholamine, C. VMA, D. Aldosterone. The correct answer is letter B. Catecholamine. So, ang cortisol mo, it acts within 20 minutes. Pero seconds, that is your catecholamine. Next, a substance that can yield a hydrogen ion when dissolved in water. A. Acid, B. Alkali, C. Neutral, D. Buffer. The correct answer is acid, letter A. So acid yield hydrogen ion, that is H+, when dissolved in water, while base naman or alkali yield hydroxide ion, OH+, when dissolved in water. Next, all are used as a liver function test except A. PT, B. Factor assay, C. Enzymes, D. bilirubin. So liver function except factor assay. Why? PT use synthetic function. Ang enzymes, sino mga enzymes kasali sa liver function? AST, ALT, so sila yun. Bilirubin naman, that is also for your synthetic and excretory function. Factor assay, ginagamit natin yan sa hematology. Okay, next. High risk level of total cholesterol for age 40 years old and above. Sino daw, anong level ng cholesterol ang high risk para sa mga edad 40 pataas? A. Greater than 200 mg per dl, B. Greater than 220, C. Greater than 240, D. Greater than 260. So the correct answer is letter D. Greater than 260. So, ang edad 20 to 29 years old, the moderate cholesterol is 200, high risk is 220 mg per dl. For 30 to 39 years old naman, 220 ang moderate, high naman is 240. Sa greater than 40 and above, 240 mg per dl total cholesterol is moderate risk, and ang high risk is 260 mg per dl. So next question. Which of the following is the major thyroid hormone? Recall 2021. A. T3, B. T4, C. Calcitonin, D. Vitamin D. So, sino ang major thyroid hormone? The correct answer is T4, thyroxine. So, letter B. Pero kapag sinabi natin most active, that is your T3. But the major, T4. Tandaan lang, kapag major, marami. 4, mas lamang. Pero kapag sabihin natin active, that is your T3. Next, the most important use of standard protein electrophoresis is to detect the presence of what? Recall pa rin ito, 2021. A. Monoclonal gammopathy, B. Nephrotic syndrome, C. Liver cirrhosis, D. Inflammation. The correct answer is monoclonal gammopathy. Letter A. Next, similar to non-competitive ELISA in that there is a double antibody system that forms sandwich with the hormone? A. FPA, B. Chemiluminescence, C. Microparticle enzyme immunoassay, D. PCR. So the answer for this is letter C. Microparticle enzyme immunoassay. Next, most common used clearance test and used as a rough estimate of GFR. Sino daw ang most common used clearance test? A. Creatinine clearance, B. Urea clearance, C. Inulin, D. Cystatin C. The correct answer is creatinine clearance, letter A. Next, considered as a medical emergency. A. Ketonuria, B. Glucosuria, C. None, D. All of the above. The correct answer is letter A. Ketonuria. Next, which is necessary for enzyme activity? A. Coenzyme, B. Cofactor, C. Activator, D. Isoenzyme. The correct answer is letter B. Cofactor. So, organic cofactor, that is your coenzyme. Ang inorganic cofactor naman, sila yung activators. Tandaan, organic, may O. Ang coenzyme may O. So, that's organic. Yan lang tandaan nyo. Activator naman, ang inorganic, nagsisimula sa letter I. Sa activator naman, may letter I. So, activator, inorganic. Organic, may O sa coenzyme. Organic. Ganun lang. So, thank you so much and God bless you all.